Hello and welcome to another episode of the Your AKT Podcast, which is hosted by wellmedic.co.uk. In this scenario, we're going to cover feeding problems in children, which actually is a really common area that we encounter as GPs and future GPs. Now, the scenario for this podcast is a 4-month-old child who has suffered from regurgitating feed since they were 4 weeks old. The infant currently has 110 mils of formula every 3 hours and is reported to be distressed in every feed. The child examines completely normally, has no medical history, and is currently thriving with a weight of 6 kilograms. How would you manage this child? Feel free to pause this podcast as you plan your next moves. Now, ultimately, this scenario is looking at an infant who has rather classical reflux symptoms, and how will you then manage that patient? Now, gastroesophageal reflux is incredibly common. It affects about 40% of infants, and it will often resolve by 1 year. Now, it's gastroesophageal reflux disease when it causes quite significant symptoms. And typically speaking, reflux in itself starts well before 8 weeks old. Now, as we have a formula-fed infant, the treatment is different to if the child was breastfed, and we're going to cover that in a stepwise manner in terms of the management of reflux as per NICE guidance. So firstly, we're going to review the feeding history, and we've done that within the history already, because what we know is that the patient is having 110 mils of formula feeds, and they're having this every 3 hours, so they're having about 8 feeds in 24 hours. The second thing that you may want to consider is, can you reduce the feed volumes? But you would only do that if the feed is excessive for the infant's weight. Now, how would you go about calculating the patient's feed requirement? Well, feed requirements can be calculated as 150 ml of formula per kilogram in 24 hours. And actually, some babies, especially if you've worked in pediatrics, you'll know that they can tolerate up to 180 ml per kilogram. And then what you do is you split that by either the 6 or 8 feeds that they're having, depending on what's normal for the child, and parents can then reduce that feed volume. Now, if that doesn't work, you may want to just offer a trial of smaller and more frequent feeding. So if they are having 8 feeds in 24 hours, you may want to up that to 10 or 12 feeds in 24 hours. Now, the final thing that you try is offering them a trial of thickened formula. So examples of this are formulas containing rice starch, cornstarch, locust bean gum, or even carob bean gum. And an example of this would be Carabel, which parents can add into their feeds. And if at that point you're still not getting any results, then you would consider a 1 to 2 week trial of alginate, and that's most likely to be Gaviscon. And when you put someone on Gaviscon, you want to be reviewing that regularly so that you can take the child off. And just one of the things to be wary of Gaviscon, it can make children constipated. So I hope you found this scenario useful, and please do share these podcast scenarios with your peers. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.